Hello, everyone. Thanks for joining us on the World Health Network YouTube channel. My name is Ben Calderwood, and welcome to our latest Long COVID broadcast. This is part of WHN's Long COVID Awareness Campaign. A little about the campaign before we meet our guests. We launched the Long COVID Awareness Campaign to accomplish a number of objectives. First and foremost, to educate people about the long COVID crisis, to explore the numerous health impacts associated with long COVID, and crucially, that includes dispelling myths around the condition, and to discuss opportunities for long COVID research and advocacy. Specifically, we want to make an effort to reach out to people who are fortunate enough to not have been touched by long COVID so far, because the long COVID community needs allies. And these are people who are willing to reckon with the urgency of what amounts to an ongoing mass disabling event and to make choices accordingly. And we'll talk a little bit with today's guest about what those choices and what that action might look like. Probably the most important thing to share as we continue having these conversations is that everyone is at risk. Long COVID is not limited to people with pre-existing health conditions. It is not limited to people who haven't been vaxxed or to any other group, or adults for that matter. And that's going to be the focus of our broadcast today. We're discussing long COVID in children. So if you've had COVID, you are at risk of post-COVID health impacts, including long COVID, which leads us to sort of the final thought before we move to our interview, and that is the best way to avoid long COVID is to avoid COVID infection entirely. So for more information about WHN and the Long COVID Awareness Campaign, you can visit us at whn.global. All right, so I'd like to now shift our attention to today's guest. We're talking about long COVID in children with Megan Carmilani. She's based in Charlotte, North Carolina. She's a disability advocate and the founder and president of Long COVID Families, an advocacy organization focused on supporting children with long COVID and their families. We're really happy to welcome you to the broadcast, Megan. Thank you so much for participating today.
Yeah, I'm thrilled to be here.
So you have a pretty interesting backstory when it comes to advocacy around long COVID and around post-viral syndromes generally. Tell us a little bit about yourself and your history and how that led you to long COVID advocacy today.
Sure. So I don't personally have long COVID myself. However, I have infection-associated conditions. So I have things like POTS and I have ME/CFS, and all of these conditions were rooted in an infection I had at the age of 11 because I had mono when I was 11. And it took me almost 30 years to be properly diagnosed and to get proper medical care. So that was actually 2018, 2019 is when I started getting my diagnoses and starting to learn about the conditions and starting to learn about post-infectious conditions in general, because like most of the public, I had no idea about any of them. And so that was a really eye-opening experience. And like I said, that was like in 2019. So when 2020 came around, I was really paying attention to COVID, like many people in the infection-associated community, because we clearly knew what infection could do to a healthy person. When I was 11, I didn't have any underlying conditions that we were aware of. I had no, my family had no reason to believe a mono infection would do any. And when I was a child, there was no adult in my life that was recognizing the major impact on my health that this infection had, or was really able to see the struggle that I was having. It was kind of all chalked up to puberty and being a teenager and growing pains and not sleeping well. And, you need to exercise more or eat better, or it just got blamed on all kinds of different things, which is easy to do with children because children's bodies are just in dynamic periods of change. Plus it was the 90s at the time and no one, even less information was available, I guess you would say. So in 2020, like I said, I was paying very close attention to COVID and really just following the research that was coming out on Twitter. And it was I'm sure people remember, kind of a confusing time about all the information that was coming out. But I was watching television in April of that year, and I heard a pundit say, on the news that COVID was not affecting children, and it was a real declarative statement, like somehow children were immune to COVID. And I just remember like pausing and thinking to myself, number one, how would you even know that this early in the pandemic? Like, how would you even know that? And then the second thought was, of course, infections impact children. We know this. And there's a real risk that it could, being such a severe infection, could really disable a certain percentage of them, which I had just learned about. So I was immediately alarmed by this declarative statement that somehow children were just fine and we didn't need to worry about them. And I was really concerned that if it did impact children similarly to me, the way I was impacted as a child, and this was the narrative right out of the gate, what chance would they have in accessing healthcare? So those were the things that were going through my mind just in that immediate moment. And I was really worried that my personal story would get repeated over and over and over again. And kids would have to wait decades for care or just not ever get care. So I didn't really know what to do with the concern other than I just posted it on my own private Facebook page. And I just shared my story for the first time because I don't think I'd ever talked about it publicly. I don't think most people in my life had any concept of the fact that my health conditions were rooted in this infection and that I'd been dealing with it for 30 years. So I posted the story on Facebook, and then I just continued kind of posting for the next couple months, various things about COVID. And as we learned more about long COVID during that time period. And then by the fall, something interesting happened, something like I wasn't expecting, which was I started getting DMs from families who were saying things like, my sister's son had COVID over the summer, and it's months later, he's still not better, and his symptoms sound like yours. And then it just kind of word of mouth, because parents had nowhere to go, is I started getting these messages asking for advice, asking for like what they should do and what kind of doctor they should see. And, you know, were there any kind of lifestyle strategies and really a lot of families were just really seeking validation that infection associated conditions were real in children, because they were going to the doctor and being told that, you know, the kids were fine and having their concerns dismissed. And that just basically snowballed, and it ended up in forming into long COVID families. It was just a direct response to a community need, that there was no real resource out there for families. And we just very quickly put a website up and just dumped a bunch of information and links on a website. And to this day, families tell us it's their only source of information. You know, where they go is either our website or our social media feed.
This all came from parents responding to your personal story,
Yeah,
and right, and reaching out to you just directly on Facebook.
that was it. Yeah.
They felt they had nowhere else to turn.
Yeah. And then it was one of those moments of like, no one's coming to save us, so we're going to start long COVID families. You know.
So tell us a little bit about long COVID families, the work that you do, you know, and the sort of key focuses of your organization as it stands today.
Sure. So our mission is to accelerate pediatric research and ensure safe and appropriate access to education and essential medical care. And that's a response to what families say their primary needs are. So obviously pediatric research, I always say that research is hope. That's where we're getting our understanding of pediatric long COVID. Potential treatments hopefully are coming. That is really where the hope for us lies. We also focus on education, because one of the things the families gave us feedback on was that they were having a hard time keeping connected and enrolled in schools, and having schools really understand what long COVID was and how to accommodate long COVID. I actually happen to be a former reading specialist and have a background where I was on IEP meetings and as a patient. So I have the experience of being on the IEP team and you know, in a special education department. And I've also had the obvious experience as a patient. So felt like that was an area we could really help families in. And then we're hoping to help more with accessing care, and really a lot of our advocacy is around that. So what we really are focused on right now, though, is that we're still in the awareness phase for pediatric long COVID. I would say we're like 2 years behind the adult population as far as where we are in research, where we are in just the public's knowledge about it. So a lot of our time's just spent explaining what it is. We really tried to help families navigate medical systems. We advocate for policies and research initiatives that help advance treatment options, support services. We focus a lot on community support, because in many ways, since the beginning of the pandemic, families have really just felt alone and isolated. And we're really trying to cultivate a community where people can connect, collaborate, but also join together to advocate for shared goals and shared initiatives. We're very focused on trying to get the pediatric research going. There's not a lot of research beyond the Recover Initiative, which is an NIH-funded initiative. There's only one clinical trial for pediatrics right now, and it's really, really small. So we're in desperate need for pediatrics. And then we're also, we just spend a lot of time educating families on what long COVID is. It's kind of, it's different for the pediatric population because children can't take themselves to the doctor. Children don't necessarily know that something's wrong with them, or that they're in need of medical care. So, long COVID in children really has to be observed by an adult. And if the adult doesn't know what to look for, they don't necessarily know what kind of help to seek, if that makes sense. And so a lot of it is just educating families, because oftentimes we'll hear from parents saying, like, I know something's off. I don't know exactly what it is. I just know my kid's not the same. And so part of what we do is start to educate families on like how to notice things and what to look for and how to talk to doctors.
I think we'll talk more about kind of the advocacy aspect of this in terms of how we take this information and speak to schools about it in particular. I think a little bit further down the road in the interview, but I do want to say that I think it's important to point out that this structurally, this focus on research, which then kind of gives families the information they need, of course, to care for their children, but also to speak to schools in turn, right? There's kind of a logic that this process follows that I think stems from the fact that COVID in children has unfortunately been ignored for such a long time, right?
For children in particular, it is so easy to miss the symptoms in them, especially if the narrative, I think what has happened is the narrative out of the gate was the kids were fine. And I think that it really, part of our mission right now is that we have to show that it is actually happening. And this is where we need the research, because it was so easy to dismiss what's happening. We know something's going on with children. I mean, you can read the headlines. We can see higher rates of absenteeism, skyrocketing mental health issues. We can see the kids are struggling. It gets really complex because the effect of the pandemic is real. I think there is something to be said about the fact that we've never really grieved. We've never really processed the pandemic. I think children do pick up on that, and I think that does have an impact. I do think, but as far as separating, so it's really easy to kind of blame that for everything, and it gets really blurry. Because I can't tell you, especially in the early years when we were trying to advocate around long COVID, everything got blamed on lockdowns. Just everything got blamed on lockdowns. And I don't want to say it doesn't have an impact, But we were having a hard time making the case that maybe the infection had the impact because the narrative was so strong about kids were fine. So that's where we really needed the research. And I think where like the Recover Initiative, because it's so large and such a big study, and it's really solid research. And I happen to be on the pediatric coordinating committee for the Recover Initiative, and that committee oversees, manages the scientific process of the research study. And it's got like 60 sites across the nation, you know, thousands and thousands of kids are enrolled. They have a control group. Not only that, they're testing antibodies to verify the control group. And the research coming out of that is really important because it's able to show that long COVID in children is happening, and it's happening on a large scale. And so until that research started showing up, until we had that data, no one was paying attention.
And I believe you mentioned that the Recover Initiative will be publishing something in August. Is that correct?
Mm-hmm.
Great.
Yeah.
So that's something that families and pediatricians can look forward to.
I mean, if you want to go over the research, there was a state-of-the-art review that actually came out in February. That was done by many of the researchers associated with Recover, and I actually have it in front of me. They actually, what was interested in it, it actually included electronic health record cohorts as well as the observational cohorts from the Recover study to estimate disease burden, illness trajectory, and clinical manifestations and outcomes. And this was a really interesting study that didn't get the attention I think it deserved. I think it's interesting because when you still hear about it, the long COVID in children, most journalists and even government reports will mention the CDC's research, and they will skip this state-of-the-art review. The CDC's research is from 2022, and it is a survey where they surveyed parents.
Right.
This was much more robust. And this review that came out in February, what it said was the prevalence of long COVID in children is 10 to 20%. So that's on par with adults.
Absolutely. So
one thing we would ask is people stop saying it happens less in children, because that's not accurate. And all that does is lend to minimization. And then they estimated, based on the prevalence and the amount of kids who've been infected, they were estimating as of 2023, 5.8 million children with long COVID.
Extraordinary number.
Yeah.
Let's, if I may, if we're talking about lack of information, sort of helping to encourage minimization when we have this discussion, let's get into how long COVID manifests in kids, symptoms, how that experience is distinct from adult long COVID, what the research tells us about symptoms and the experiences of children.
So there's a major Recover study that should be publishing within the next month or two. That's going to really help characterize what long COVID in children looks like. The abstract of the study was actually presented at the Pediatric Academic Societies meeting in Toronto, which was in May. So we do have the abstract. I'm actually a co-author on this. So the study was to characterize pediatric long COVID symptoms and how they differ based on a child's age. And so again, this is where they compared prolonged symptoms in participants without a history of COVID-19 infection, which they verified with antibodies. And then they compared it to the symptoms most likely linked to long COVID. So what they found was that across all ages, these symptoms, kids across all ages had in common, which included low energy, tired after walking, headaches, body, muscle, and joint pains, lightheadedness and dizziness, trouble concentrating or focusing, GI and GI symptoms. So those were the core symptoms across age ranges. but they did notice that symptoms varied depending on the age. So school-age children had more prolonged phobias, fears of specific things. So we're seeing a lot of neuropsychiatric symptoms in kids. And I don't know that families know that that's associated with COVID infection. And then we're also seeing school refusal is considered a symptom that they were tracking. And so that's just, I really want to, I'll come back to that in a moment because I want to talk about what that means. For adolescents, we're seeing things like fear of crowds, fear of enclosed spaces, panic attacks. So in little ones, we're seeing things like fears of specific things. And in teenagers, we're seeing panic attacks. I don't think that's widely understood to be associated with COVID. Smell and taste was more commonly associated, loss of smell and taste more commonly associated with adolescents, but I do want to flag it's hard to know with children.
Sure.
And so what that looks like in children is, like in the young ones, it will look like not wanting to eat. And so usually it will be, the child will ask for food. So they'll say they're hungry and they will ask and want to eat, and then they will take a bite and then they'll push it away. And that's usually a sign that something's going on with their taste and smell. It's they ask for food and then refuse to eat. And that's important to know if kids have lost their taste and smell.
Can I stop you there and ask you to address, we talked a lot when we prepared for this interview just about the notion that children, young children in particular, they don't necessarily have the vocabulary to express their symptoms. Right. I think that's a good potential example of that. So I think part of your effort, as I understand it, has been, working to help parents and pediatricians and doctors ask child-centric questions to help get to the bottom of this diagnosis. Can I ask you to expand on that on that challenge when it comes to treating long COVID in kids?
Yeah, so when we talk about educating parents, that's the kind of thing we're talking about, because the way children experience symptoms, the way they'll articulate it, is going to be different. So I'll give you my own personal example, was that when I was 11 years old, I told adults that I couldn't breathe. I had this sensation in my chest. I didn't know what it was. It was a weird sensation. And the best I could come up with is I kept saying, I can't breathe. And we went to the doctor, tests were normal, and I was told that's anxiety. So for the rest of my life, I associated anxiety with this feeling in my chest. And I thought that's what everybody meant by anxiety, because when you're a child and an adult tells you, you take it in, you have no other reference. That's just what I thought anxiety was. I was 39 years old when I found out that was tachycardia. So I went almost 30 years thinking that was anxiety, and that was literally tachycardia. Which is really significant and disabling. And I just thought I had an anxiety issue I couldn't get under control. And so that's just the importance of really trying to figure out what kids are trying to communicate.
Sure.
Because the consequences of not catching it are really significant, right? We have here I have actually some examples written down for you. So these are real things that children have said. So a child will say, my legs feel heavy, indicating fatigue. My head hurts, describing difficulty thinking. I don't want to go to school, which is school refusal. That's post-exertional malaise, which is a delayed, actually, let me get you the actual definition. So post-exertional malaise is a very common symptom in long COVID. It's also the cardinal symptom of ME/CFS. And it's a symptom that's been reported in children. PEM is a flare of symptoms or the appearance of new symptoms after exertion. And that can be physical, emotional, or mental exertion. And that's often presenting 24 hours after the triggering event. It can really present up to 72 hours. So it can even be sensory overload for kids. And what will happen is they'll crash, right? They'll be so tired, they might not want to get up out of bed. They can't get off the couch. They don't want to go to school. So children don't have the language to say, I went and played soccer yesterday, and today I can't get out of bed. Like my body feels heavy. I don't want to go to school. And so it's interesting that one of the symptoms that they're tracking is school refusal, because it's how else would you expect a child to say they're fatigued? How else would you expect a child to say like they have PEM? Like that, with the language they have, they would just say, I don't want to go to school.
Of
I mean, I
course.
think that really makes sense that that's happening. But yeah, so parents and teachers and educators really kind of need to, when a kid's saying they don't want to go to school, I think the assumption is school, like it's school avoidance, like they just want to get out of responsibility in some way. And I think it's more of a invitation to pay attention, to be like, what is happening with this child? Why is he saying that? And
Mhm.
then paying attention a little bit more. And this is where like knowing the symptoms of long COVID might be helpful. The symptoms that I'm sharing, there are 15 of them. I call them predictive symptoms. Like they're most likely to predict that a child may be experiencing long COVID. They're not diagnostic.
I see.
It's just more of like, if you're noticing these symptoms, go talk to your doctor. You might want to talk to somebody about long COVID, kind of a thing. There's some other examples of like a lot of feedback on like the kid will say something along the lines of like, I don't want to eat that. That's gross. We had a lot of specifically girls, teenage girls get told that they had an eating disorder, even though the child was saying, no, I don't. And then later find out, no, they had loss of taste and smell and GI
Mhm.
symptoms, and that's why they weren't eating. And so it got confused with an eating disorder for a lot of kids. It's very common for like a child to say, for instance, it's hard to walk upstairs. That could indicate a struggle with POTS in particular, which is postural orthostatic tachycardia syndrome. That's you get tachycardia based on changes in position. So as you're
Rapidly
walking
increased heart
up,
rate. We should say tachycardia. Yeah.
yeah. So
Yeah.
as you walk upstairs, that's changing your body's position, right?
Mhm.
So that would trigger it. A lot of kids, a lot of parents will say that their first sign that their child had long COVID is their child refusing to do homework, saying I can't do, all of the sudden saying I can't do it. And what they're trying to communicate is they're having cognitive challenges.
Mhm. Mhm.
But that's so easy to misinterpret as in the kid just doesn't want to do homework, you know?
You-
And another odd one, but I've heard it a lot at this point, is little ones will often say that their throat hurts. And then if you ask them where does their throat hurt, they'll point here. They'll point
Huh.
here. And I think if you've ever had strep throat, it like hurts in here, so they get
Sure.
confused. And what they're doing is they're pointing between where your head connects to your neck. What they're
Mhm.
likely saying in a lot of these cases is they're talking about a migraine,
I see.
but they're saying their throat hurts because what do you call this part of your body?
Yeah.
You know,
This
so those are some examples.
I wanted to introduce a term into this conversation that a lot of these challenges in interpreting signals and the verbiage used by children to describe symptoms like this leans into something that you described as adultism.
Yeah.
This notion that we just normal everyday people, when we have discussions like this, and physicians and doctors and pediatricians, maybe even pediatricians as well, have a bias towards adult-centric framing about conversations around medical conditions and how individuals experience their own symptoms, and what a challenge that presents for a condition as potentially as wide-ranging and complicated as long COVID.
So yeah, so adultism is actually something I started learning about early in the pandemic as I was having conversations with various researchers and experts about like, why aren't we talking about children?
Yeah.
And someone introduced me to the concept of adultism, which is basically a systemic bias towards adults that favors adults and disadvantages children. And so it is, if you're operating so early on, pediatric research, a lot of it just took adult symptoms and applied them to children because we were operating from the assumption that adults are the center, and I guess children are just little adults, which they are not. And what happened was that, sure enough, children were not low rates of long COVID. Look at that. Well, because you're using adult symptoms. Like, children's bodies are radically different. Their immune systems are different, and as I said earlier, they really are in these dynamic periods of change. The infection, illness is not going to affect them the same way,
Absolutely. I think that idea about this moves us into the domain as we sort of kind of move on to our next question. But I did want to address this idea about just developmental impact on children as it relates to long COVID, and obviously the great sort of social and political pressure to make sure that children go back to school and stay in school, and what impact that is going to have when children are potentially dealing with neurocognitive challenges pertaining to long COVID and so on, and how to some extent these desires can be very challenging for parents and for society who for many reasons want or need to have their children participate in day school.
Yeah.
So
I think, when we shifted the burden onto the individual, I just, families were put in a really difficult place. What are you going to do? You have to go to work. So children were sent to school and sent to daycares. And I think a lot of families just wanted to trust, right, that we were doing the right thing. It's interesting because the rates of infection you can see of children, I don't have the numbers in front of me, but the mass wave of infection was Omicron. Part of the thing too is we weren't hearing a lot about long COVID in children in the beginning of the pandemic because they weren't getting infected
right
at the same rates that adults were, because schools were closed and in many places they were requiring masks, right, for a really long time. And so they just weren't getting infected. It wasn't until Omicron that kids were like almost universally infected. And then we saw our first wave into the community 6 to 9 months later. So it's interesting because it takes time for families to understand their child has long COVID. And because again, it's the observer effect. It's when it's not your actual body, it takes you longer to observe it in another. And it's really hard to distinguish between right behavior. So, and we don't expect children to be sick. We don't expect children to develop long COVID. We're not looking for it. We were all told the kids were going to be fine. So, by the time families get to us, children have really progressed to the point of disability, where it's impacting their functionality and their ability to go to school. That's usually when we hear from families, is when they're struggling to go to school.
I see.
I do want to add, I wanted to share too the symptoms for under 5.
Okay.
So yeah, I don't think most people realize even babies can develop long COVID. So what you would see in children under 5 are things like poor appetite, trouble sleeping, fussiness, prolonged respiratory symptoms, like they have a stuffy nose for a really long time, they have a cough for a really long time, compared to children who have never had COVID. So those were the symptoms that stood out. And these are just, collection of the symptoms. More research is pending, but there's a significant impact on the under 5s. We're starting to see developmental delays in some of our kids.
What does medical care look like today for children living with complex chronic illness like this? I mean, you have personal experience of this, of course, when you were young. Has anything changed?
Not really. Not really.
Yeah.
because children, for the most part, you know, I mean, they're not getting, prior to 2020, it wasn't that common to develop these conditions. And for a child, and long COVID's just this, it really is multi-organ for children as well, multi-system for children as well. I mean, just like adults, our medical system is just not structured for it in pediatrics, but I would say it's even more limited because we just do not have the same number of specialists for kids. There aren't that many neurologists. There aren't that many specialties. So there are a handful of clinics in the country that are still open for long COVID. Most of the pediatric long COVID clinics have closed. They were really geared towards MISC in the early years, which is a condition that can fall under the umbrella of long COVID. It's an inflammatory condition and it can be life-threatening. So in the early years, a lot of attention and resources went to that, which is understandable because it was life-threatening. It's not happening as much in children anymore after infection. And so some of those clinics closed down. So, I mean, really, there's like 3 or 4 in the country. And even if you go to these clinics, in adults, they can do off-label usage drugs to manage a lot of symptoms. That's not as likely to happen in children, especially if they're under 12, for good reasons.
Sure.
You don't want to make things worse by adding medications that we don't know how's really going to react in children. But we're getting reports of things of, pediatricians, I mean, are still telling parents that long COVID doesn't happen in children when they go to seek help. In Charlotte, I've been told by families that a waiting list to go see a rheumatologist is now like 18 months to 2 years long.
It's extraordinary.
If a child has POTS, which is dysfunction of the autonomic nervous system, in most places, I don't know of a doctor in most places where that would know anything about it, let alone the type of testing that would need to be done isn't available in most of the country for adults, let alone kids.
Speak a little bit, if I can ask you, about the risks that parents may face when they are concerned their children might be affected by long COVID, when many doctors are still denying that long COVID exists in children. They might be accused of abuse, of neglect, and speak about the political challenges around parents working to have their child, properly treated for this condition.
Sure. Yeah. So long COVID is mostly an invisible illness. And even if it's not, we don't have access to the testing necessarily that would be needed to show what is going on. And so diagnosis really is reliant on the patient's ability to articulate their symptoms, which puts children at a disadvantage. And then it's reliant upon, first the child has to express it in such a way that's going to get noticed by a caregiver and understood to be that it's a medical condition. And then the caregiver has to go and express and articulate these symptoms in such a way that's going to get recognized by the doctor. And the doctor has to be informed enough about long COVID to recognize it. And that kind of chain of event, there's so many things can go wrong in that chain event. So many things can be missed, due to the fact that it's just patient reported symptoms. It really puts it in a lot of power in the doctor's hands as far as whether or not they want to accept the symptoms to be real. Right. And so if you go and you say, these are weird symptoms and the doctor's not familiar with it and your child's not eating, your child's having GI symptoms and they don't really make sense. And the thing about long COVID is that the symptoms wax and wane. So one day you may have them, the next day you may not. It's a dynamic disability, and that's very not well understood. And so I think there has been situations that have been reported to us from families where doctors have accused parents of Munchausen's by proxy, We had situations early in the pandemic where children were actually removed from the home, and CPS was called, and the family
If
was
I can,
reported.
we should probably explain what Munchausen by proxy is.
Sure, sure.
I think, right, that's the issue where, a caretaker is accused of attention seeking by claiming someone in their care has an illness that the ostensible professional of the room believes they do not have, right?
Correct. Yeah.
Yeah,
Yeah. And it's the idea that maybe the family's seeking secondary gains of some sort. They'll
I
get
see.
accused of that too, of like,
Uh,
are you trying to get some sort of disability payment for your child? Are you
I
trying
see.
to get, is there something you're gaining by this? And so like early in the pandemic, the narrative was strong and the research wasn't there. And so when the family was going with symptoms, they didn't make sense to the provider.
Mhm.
And so, yeah, CPS was called. There was a number of cases, and children were removed. Families, were accused of neglecting their child. What long COVID can look like in little ones is failure to thrive. A lot of the kids were getting diagnosed with failure to thrive, and then there were situations where families were accused of neglect. Um, you know, because it was poorly understood. This is an issue beyond long COVID. This is an issue for a lot of rare conditions,
Mhm.
um, you know, that are poorly understood. So
So,
yeah, that is a threat. And it gets very complex with children because unlike when it's an adult reporting symptoms, you run the risk of there's a child can be removed from the home
mhm.
if a third party decides that something is unhealthy and wrong happening, right? So, and it gets really complex because oftentimes custody is shared with parents. One parent might believe in long COVID, one parent may not believe in long COVID. It can become an issue in custody. There's a lot of complexity around whether or not to seek care, whether they're allowed to seek care. We've had issues where it's been court ordered where they're not allowed to seek long COVID care.
My God.
Um,
Whether or not a court order to
mhm.
not seek long COVID care
Yeah,
specifically.
because it was over medicalizing the child and causing psychological damage,
Huh.
according to the expert one parent brought in.
I can't help but think that, the numerous issues that adults, ostensibly well-educated adults face in terms of trust when speaking about their symptoms, when seeking care for long COVID, and for other, as you said, long-term chronic illnesses in particular,
Mhm.
can only be multiplied by God knows how much when we are talking about children and all of the other complexities involved in their care and supervision. I think that's kind of what you're describing right
Yeah,
now.
we do have families who have reported like that they're afraid to tell their school, that they're afraid
Sure.
to tell their doctors. Um, a lot of families will have a long COVID specialist, but not tell their pediatrician,
Hmm.
because the local pediatrician may not know and may not be as well informed about long COVID, and they're traveling out of state to get care at a clinic, and they just um, are separating it out. Um, yeah, but I can report like it seems to be getting better.
Mhm.
Awareness seems to be growing. Um, so I think more and more of the research that's going to start coming out, it should be helpful with that. So there is some movement on it. We also still get a lot of pushback. Families get a lot of pushback on mask wearing. Still to this day, a lot of misinformation still coming about immunity,
Of
um,
course.
and vaccinations, and the need for them.
When we're talking about misinformation, we're talking about schools. Let's move on towards generally in the direction of the topic of advocacy. And obviously, when we're
Mhm.
talking about long COVID and kids in particular, schools are very much a part of the equation when it comes to advocacy, how they're responding to this challenge. Let me ask you, in your opinion, what specific challenges do children with long COVID face when it comes to school, when it comes to attending school? Do you feel that there are type of support that schools can offer? And as a practical matter, how are schools responding to this challenge?
I think that so schools are very lockstep, right? They don't bend easily. It's difficult. I mean, I can speak as a teacher. It is difficult to accommodate a condition like long COVID because of its dynamic needs. I
Sure.
think a lot of disability policy in public schools is really catering towards the idea that the disability is fixed, right? So you might have ADHD on a Monday, you're going to have ADHD on a Tuesday. So
Mhm.
then I know what to do to support a child with ADHD because it's going to be the same every day, or it's going to be similar enough,
Or
right?
a musculoskeletal disability of some kind where they need an
Yeah.
accommodation to help them learn, something to that effect.
Yeah. So, the thing about long COVID is that you can have a child fully engaged in class on a Monday and then totally crashed out and not able to take in new information on the Tuesday,
I see.
right? And that's really difficult for schools to understand and try to accommodate. And so, one of the things we're running into with schools is that, well, first, they haven't been trained in how to accommodate a disability like long COVID. I know I wasn't trained in how to accommodate a disability like long COVID. There isn't like best practices somewhere. There isn't a guide somewhere right now about how to do it. And because the thing is with long COVID, it could manifest in so many different ways, right? So a child could have cognitive conditions, but everything else is totally fine. Another child could simply have POTS where they might not be able to stand for very long and might need electrolytes and might need to use an elevator, but cognitively they're doing okay.
Mhm.
You could have another child that, is only able to be in school for 2 hours a day and then they crash. So it's not like it's a one side, like again, ADHD or something like where you have a common understanding of what long COVID is. Because long COVID is really an umbrella term for all kinds of, conditions that happen to be triggered by COVID. In adults, that's over 200 symptoms. And so it could be so many different things. So I think that's part of it is like, we're not really sure what the symptoms are going to be. One of the major obstacles to getting support in schools is the narrative that children recover from long COVID.
I see.
So there is a huge, we went from, COVID doesn't impact children. And then it became, well, children get COVID, but they don't spread COVID. I don't know if you remember this.
Oh, I remember it well.
And then it became, well, okay, children get COVID and they spread COVID, but it's
But it's
fine.
mild.
It's
Yeah.
mild. And then children don't get long COVID.
Yeah.
And then now it's, well, children get long COVID, but they recover. And so that's where we are again. And here's the thing. If children recover from long COVID, then there's no need for the school to do anything. Because if it's just an amount of time before children recover, then that's just an extended illness.
I see.
That's not a disability that needs to be accommodated. So what's happening is they make families wait 12 months before, a lot of times before they'll engage and they'll treat it as a disability.
Mhm.
That's a lifetime in a child, and then you wait 12 months and then you have to assess them. And then depending on, like, there's no protocols about how to assess a child with long COVID. So then the family ends up having to fight for different tests and it's a whole thing and then it's several months. And so oftentimes children won't even get accommodations, won't even get, children with cognitive difficulties will need an IEP, which is an individualized education plan where they get like specialized instruction. It can be 2 years later, and what we're really running into is the children who have fatigue, which is a substantial number of kids. They can't necessarily go to school all day long, and so they're getting pushed out of the building and put into, sometimes they're in, partial day programs. Sometimes they're told to do virtual school. The thing is, if they're having cognitive difficulties, long COVID can kind of manifest as sort of like this viral brain injury like symptoms, kind of on par with a brain injury. You can't put someone with a brain injury on virtual school for 5 or 6 hours a day.
Right.
It's just not going to work. So a lot of our kids end up in something called homebound programs, and a homebound program is a program that's really designed for a child that was like in a car accident or had mono or something like that, where they're going to be out of school for 3 to 6 weeks or had a surgery or something. And that program's designed to have like a teacher come to your house for 4 hours a week. And it's meant to be temporary. And you're meant to do just the schoolwork on your own in between. Well, some of our kids have been in homebound programs since 2020, which means that they've only had how many hours of school in 4 years? A substantial number of our children just withdraw. So families will just pull them out of school and homeschool because the schools just are not accommodating them, and it's just such a fight, and it becomes about attendance, and that has legal ramifications. One of the things that I think schools are really struggling with is that children with long COVID in particular, when you have conditions like these, it's true for myself as well. When we get sick, it takes us a long time to recover. So we can just get a cold and it can take us 3, 4, 5 weeks to really recover and come back and be able to like attend school again. Well, a lot of school districts, the law is 5 days. So if you're not back within 5 days, even with a doctor's note, they'll shift you to homebound program. So kids who could attend school, if they weren't getting sick all the time, are then forced out of school buildings because they're not able to come back within 5 days, if that makes sense.
Yeah. Is it fair to say that from the school's perspective, a lot of this derives from them thinking about this in terms fundamentally of attendance and funding?
Yeah.
Yeah.
Yeah, it's really about attendance. One of the points of friction, I guess you could say, for our families is that before a child gets a long COVID diagnosis, they're showing the symptoms. And one of the symptoms is like, school avoidance, is the inability to attend school on a regular basis. And this is where, when they don't actually have the long COVID diagnosis yet, it can become very problematic, because if they're out of school for 5 days, suddenly a truancy officer's on their doorstep. And so a lot of our families are spending a lot of money on lawyers fighting truancy charges in court. When you talk to families and you ask like what would help, it would be a kind of if schools were able to put the curriculum online and allow the child to go to the school when they're physically able to school, and then kind of shift and be a little more dynamic. It's important to families to stay connected to schools. I think it's important to all of us that, the kids stay connected to the schools.
So I think you've kind of answered this question already in terms of all of the challenges that children dealing with long COVID may face relating to school. But in general, what are the most important things you feel that people working with children, of course, teachers, caregivers, school administrators, pediatricians, should know about long COVID?
I think what people really need to understand is the dynamic nature of it, the way the symptoms wax and wane. I think one of the things, I want to go back to recovery for a moment, because I think that word gets thrown around a lot, and I don't think people are operating from a common definition. Like, what do you actually mean when you say the kids are recovering? So, because I think a lot of schools and everything around it, we're just kind of holding our breath, thinking the kids are just going to kind of get better on their own. And I want to say that children do get better at rates higher than adults. they do recover at better rates. But we've noticed a distinct pattern in which kids recover and which kids are really struggling. And it's the kids that are allowed to rest early on. It's the kids who are identified early as having long COVID. It's the kids the families know that it's long COVID and it's important to rest. And children are allowed to listen to the needs of their bodies, which means that if they feel like they physically can't go to school, they don't have to go to school. That they're allowed to take breaks, that they're not forced to override the signals of their body, and they can access rest and repair. We have way better outcomes. And children who are allowed to pace. And part of the challenge in allowing kids to pace and take their time and rest are these attendance policies, and it's the families that, honestly, it's the families that pull their children as soon as they know they have long COVID, they'll pull them and put them into homeschool. Those kids tend to recover. It's the children that are forced back into school 5 days later, right? That seem to be, this is just community observation, and what families are telling us is overwhelmingly the thing we get from parents a lot is we should have pulled them from school.
So this is how to say this, kind of a structural concern in terms of allowing policies to change. I mean, first, securing the accurate diagnosis, number one, making sure that parents, doctors, school officials understand that children have long COVID, and being willing to accommodate in a manner that fundamentally allows them to rest and recover. That seems to be.
I mean, I think the message I would like everyone to hear is that, better outcomes, including recovery, can be achieved if we recognize long COVID early, right? It's the same for almost anything. You want to identify the children who are struggling early. Early identification is really important. And then to allow the body to rest and heal is really, really important, and it will get better outcomes. And our whole goal is to get kids identified, access to medical care, access to support in schools, so that they can get better results long term. I mean, one of the things about kids is that they are resilient. We just have to let their bodies heal. And another thing I would want people to know is that what we see a lot is the kids will recover from long COVID, seemingly, and what people think is recovery, you actually talk to them, it doesn't mean return to baseline for most people. When you say you're recovered, it usually means they're better than their sickest day and they've adapted to their new normal, right? And so that's usually what it means, and they've reached a functionality where they can rejoin their life. And so we get a lot of kids that within 6 months to a year feel like they're recovered. And so they go back to school, they rejoin their life. But what happens is they get reinfected. And then they get reinfected and they're right back to where they were the year before. And so, on top of allowing kids to rest and repair, like early on in their long COVID journey, it's also, we have to protect them from getting pushed back from a major setback. There's actually research that came out on this recently of like, what happens to a lot of kids is that they will get COVID and they'll do okay, they'll recover from it, but they'll get another major infection within 2 months, 3 months. And it is after the second infection, whether it's flu, RSV, something, and that will trigger the long COVID.
When we met earlier, you described how potentially problematic that cycle of infection could be for children and parents and families who are making an effort for their children to recover. And it is ultimately that pressure to return to school, to return to a more normal level of activity, that fundamentally may put them at risk again and trigger that long COVID again, or another round of long COVID. As we think about long COVID generally and all of the sort of particular challenges that children face when dealing with long COVID, in terms of your work with long COVID families, what are your final thoughts? Where do you find hope? What are you looking forward to in your efforts with your organization?
Yeah. Well, I mentioned earlier, a huge source of hope for me right now is the research. I'm fortunate in that my role in the committee is I meet with researchers at least 2 to 3 times a week, and I get to see the progress.
Hmm.
Um, that is a huge place for hope for me, and it's very meaningful to me because I never thought I would see the day um, that MECFS was recognized, let alone you know or infection associated conditions were being studied by the NIH to the degree it is. It was a really interesting experience when, I talked about that abstract that came out and that studies that's going to come out that kind of characterized what long COVID was looking like in children. Um, when I saw that study for the first time, like it was really moving for me because those were my symptoms from when I was a child.
Hmm.
And I had spent decades not talking about my symptoms, not telling people about them because it was just inevitably going to be met with misunderstanding and kind of like confusion when I was talking about them. And so to see it coming out in a paper that was funded by the government was a big deal for me. And that was just a very definitely like for real. I never thought I would see the day that would happen, and there were my symptoms. Um, so that was very hopeful. The other place that I find hope is really, long COVID families is entirely community driven. Um, the advocacy of the long COVID community um, is, and the support people are providing for each other is really like, it may sound cliche, but it's really moving. That people are dedicating so much time and energy to help each other. I think what's interesting to me as when I was a child I'm not long COVID, but when I was a child with these conditions, and even as a young adult, I didn't know anybody else with a body like mine. I predate the internet, right? So I didn't know anybody. I didn't have any examples. I didn't have any sense of like, yeah, me too. I know what you're talking about. And even in the last couple of years with the long COVID community, I can talk about just the bizarre symptoms. And there's going to be thousands of people that are like, yeah, I know exactly what you're talking about. And I think the community right now is such an example for the children. I think that's very hopeful. I think it's a community that's, there's not in shame, that's really advocating for themselves and standing up for themselves. And
Hmm.
I really appreciate that that's an example out there for children. Um, and all the patients that are now involved in research, I think is very hopeful.
And you
Again, never did I ever think I would see the day.
I mean, again, it is interesting to consider, how, what you personally experienced as a young person growing up, trying to
Yeah.
deal with these conditions, and to see how, despite how extraordinarily challenging the pandemic has been, and how challenging it's been to get people to acknowledge long COVID as the crisis that it is, to see changes to that community happen that you and your organization, Long COVID Families, have been elemental in pursuing. So that's it's very nice to hear that part of the story, and
Yeah.
gratifying.
I mean, I'm old enough to have witnessed the change already happen.
Sure. Sure.
It's not fast enough.
No,
It's not nearly enough,
but
but
it is change.
it is change.
Yeah.
It's happened. Even in the last couple of years here in Charlotte, when I first started, I moved here right before the pandemic. My primary care doctor had no idea what my conditions were because I
Sure.
came in with I had to explain what they were. Um, she's well versed in them now. I mean, she knows what they are. She's well versed in them because unfortunately she has many patients, but on the upside, she's a really educated doctor. She's really educated on the conditions, and so that's progress.
Quite a conversation. I think one of the things that we've learned in terms of kicking off the long COVID campaign at WHN and speaking to people, adults who are afflicted with long COVID, and really trying to make an effort to understand and empathize with the challenges that they've faced. I think to be able to reflect on the unique challenges that children in particular face with dealing with this condition, I really hope our viewers find that informative and educational. Megan Carmilani, I really want to thank you for giving us this information, for having this conversation with us today. Once again, Megan Carmilani, the founder and president of Long COVID Families. If you'd like to learn more about her organization, please go online to longcovidfamilies.org. And a little bit about us at WHN. The World Health Network is a global organization working to end the pandemic as a global health threat. If you'd like to learn more about us, you can check us out at whn.global. We hope you'll visit the website and consider joining our work. So thank you, viewers. Thanks again, Megan, and we'll see you in the next broadcast.
Thank
Bye-bye.
you. Bye.